Like unfortunately many in life, I have the experience of having a rare disease patient in my family, and that experience of this prolonged journey towards a diagnosis, and then even though there was a diagnosis, there was no cure. And really this unfair situation that this created, for this person versus me, who was blessed with health and high energy, really motivated me to dedicate my life towards finding a cure for as many patients as possible. And that's why I embarked on this journey. I studied biochemistry, but I felt like I really needed a business background as well in order to bring it all together and to develop as many therapies as I could. And then I went into the pharmaceutical industry and had a lot of great experiences there, and also had the first chances to interact directly with patients. And that again motivated me to then be more specialized in biotech companies and eventually to come into venture capital. And that's where the full circle came together, being now in the Myeloma Investment Fund and leading the investments there for the patients who look into my eyes and say, yes, you're doing this for me. The Myeloma Investment Fund is a philanthropic fund. That means we don't have limited partners who give money and then expect a return, but we have donors, and they donate funds to the Myeloma Investment Fund. And dollar for dollar of that goes into the startups that we fund. So really every single cent will be spent on innovation that is hopefully going to lead to a cure for multiple myeloma patients eventually. We have, over the last 5 years, invested in 13 companies. 11 of those are still active investments that we manage in our portfolio, and we have 2 successful exits. So one company was acquired by a pharma company and another company went public. And we invested the proceeds into the fund so that we were able to invest that into novel startups. We have plans to provide further follow-on financing to our portfolio companies that are successful. And we also want to fund new companies. So we have right now a pipeline of several dozen companies that we are evaluating at different stages together with our internal and external experts in our investment committee. And we will hopefully be able to share a lot of new successful investments very soon. It is really a blended approach that we're using for our assessment. So one is obviously the science. So the science is king in many ways. So we draw on our expertise in the myeloma space. Will that be an innovative target, an innovative approach to really provide a novel therapy for myeloma patients? The second aspect is, will this approach be commercially successful eventually on the market? And the third approach is the aptitude of the leadership team to hopefully steer that ship also through more wavy areas in the sea of biotech and pharma investments. We have a very good network of both other foundations and their associated investment funds, and we exchange a lot of deal flow and information with them. But we also have a very good network of other VCs that we can syndicate with, and that is really key here. And I want to say that we're really not all that different from a venture capitalist. We are a specialized fund in this myeloma space. And we are also, what I want to what I want to say as really the best, in the best sense of the word, we are patient capital. So not just that we're providing capital for the benefits of the patients, but we're also very patient in our approach, because we don't have limited partners that require us to exit an opportunity after a very short time, but we can really spend as much time as it takes to fully develop this asset into hopefully a therapy for myeloma patients. For us, really, the patients and a cure for them is really the North Star. So that's what we have in mind, both figuratively and also with the patients' faces, with everything that we do. So I have some patients that I know and who have said to me that this is really, I'm doing this for them. So this is very different from just focusing on the spreadsheets and the numbers. So, but both of them are really not mutually exclusive. In fact, you have to be successful on the market in order to also be successful for the patients.